Why do CF treatments need prior authorization? Imagine trying to get a life-saving medication and hitting a roadblock. That's what prior authorization is about. It's a process insurance companies use to decide if they will cover certain cystic fibrosis treatments. This is especially true for CFTR modulator therapies like Kalydeco, Orkambi, Symdeko, and Trikafta. These drugs are powerful and expensive, so insurance companies want to make sure they're used correctly and safely. One main reason for prior authorization is to confirm that the treatment is medically necessary. For cystic fibrosis, this means verifying that the patient has undergone genetic testing showing they carry specific mutations in the CFTR gene. These mutations determine if the medication will work for them. Insurance companies need this proof to prevent prescribing costly drugs to patients who might not benefit. They also requiring baseline liver function tests before approval because CFTR modulators can affect the liver. If a patient has severe liver issues, some medications might not be safe, so these tests help protect patient health. Another reason is to ensure that treatments are prescribed by qualified specialists. Usually, only cystic fibrosis specialists or pulmonologists can prescribe these medications. This requirement guarantees that patients are getting care from doctors with the right expertise to monitor their condition and manage any complications. Prior authorization confirms that the prescriber has the necessary qualifications, which helps maintain high standards of care. Cost management is also a big factor. CFTR modulators can cost tens of thousands of dollars each year. Insurance companies use prior authorization to control their budgets and make sure the money goes to patients who truly need and will benefit from the medication. This process helps prevent unnecessary spending on treatments that might not be appropriate for some patients. The process doesn't end after the initial approval. Usually, insurance companies requiring ongoing proof that the patient is sticking to the treatment plan and showing signs of improvement. They might ask for lung function tests, like FEV1, to see if the medication is helping. Renewals can last up to a year, but each time, the patient or doctor must provide updated information to continue coverage. This helps ensure the medication is effective and being used correctly. Insurance policies also prevent patients from taking multiple CFTR drugs at the same time. Prior authorization checks that a patient isn't on another similar medication or is transitioning properly between therapies. This avoids harmful drug interactions and unnecessary duplication of treatment. Standardized criteria are another benefit. Insurance companies often requiring proof of cystic fibrosis diagnosis through newborn screening, family history, or symptoms. Having clear guidelines helps ensure all patients receive care based on current medical standards and approved uses. Finally, the cystic fibrosis community and advocacy groups like the Cystic Fibrosis Foundation work hard to improve the process. They push for reforms to reduce delays and make access to medications faster while still maintaining safety. While prior authorization can sometimes feel frustrating, it exists to protect patients and ensure treatments are used appropriately. Understanding these reasons helps patients, families, and healthcare providers navigate the system better and advocate for smoother access to vital medications. Remember, always consult your healthcare team for personalized advice and to understand what's best for your specific situation.